Dr. Chavez, there's lots of people, millions apparently, who have dentures.
Correct.
And dentures have overall a bad rap. They are kind of
Yes.
like a self-conscious saying that once a person wears denture, he's old. We all know grandma sings putting it in the water at night and that type of stuff. Now, and it comes with a lots of discomfort to the patient. Even if it's a lot better than not having anything and doesn't look all that bad really, but it's, you know, the person doesn't want to smile, is worried about biting into an apple, eating a Thanksgiving dinner with lots of people, and
Right.
and it, you know, it might or might never come out, but the person has that feeling.
Correct.
Now, there's apparently a new thing called implant supported dentures.
Correct.
And some of you dentists talk about it like it's like the best things in sliced bread. Tell us about it.
Well, I don't think it's the best thing next to sliced bread. The best thing next to sliced bread is for you having your actual original teeth.
Right.
You know, once you've gotten to the unfortunate situation where you've had all your teeth amputated,
Yeah.
and you're now having to deal with plastic prosthesis to do what the oral organ was meant to do, it's the efficacy of chewing goes down dramatically when you have full dentures. What implants do for you, or implant-supported dentures, it helps stabilize the denture, and it does dramatically increase the efficacy of your denture. So it doesn't get you back to where you were before, but it goes a long way in stabilizing the plates. Because what happens is the plates move around in your head. It's hard for you to chew. Many times talking is an issue because they move up and down. Especially the lower plate is a big problem because the tongue will move the lower plate forward and up. Your lip pushes the lower plate back and up. So the lower plate especially.
It's like a crowbar, kind of like
yes,
it comes out.
especially the lower one.
Yeah.
Has a lot of forces against it, causing it to bounce up and down and not to fit well.
Right.
So by just doing something simple like 2 implants right here underneath, and then the plate snaps onto it, and now it's stable. So then that's one less moving variable. The upper plate tends to be much more user-friendly to the patient. There's usually much more stability, even if they don't have implants. They tend to be much more stable. But in cases where they don't have good bone, then of course we could place several implants up there and really stabilize them, and then really rehabilitate them to a significant degree, where it's much easier for them and they have much more confidence and they can tackle tougher things, maybe like a chicken or like a small piece of steak, and feel confident that the people around them are not clearly aware that they're dealing with someone who's dealing with dentures.
Right.
Yeah.
I said about the upper one overall, on an average, fitting and holding better. Maybe it is because of like that suction they have. Apparently there's a little blade, like an acrylic or a metal thing going over, you know, over their palate. Now, if you have implant supported, and that, however, takes away the taste. Now, see, I'm coming from I like my sauces. I like to taste my different foods.
I got it.
So, and people do complain about that.
Sure
that their taste buds are gone, because mainly we test up there. The tongue, yes, but up there it's a lot.
Yes.
So, will that be improved with implant supported denture? That
Yes.
you don't need this suction thing?
Absolutely. So we can, normally a full denture covers the entire palate, okay? Because you need as much suction, as much retention as possible.
Yeah.
Once you're going on the maxilla, once you're going with implant retained dentures, then you can cut that whole part out. And you can make everything much sexier, much smaller, much more refined, and it feels and looks much more like the original thing.
Wonderful.
Yeah.
Now, obviously that is it's kind of like a hybrid. It's it's like you have implant, you have the denture, and a full mouth. If a person has gotten to the point where like he needs a whole mouth, like in a denture, that can become very, very expensive with implants. With a round of implant.
Yes.
It's better than the denture, I suppose, even the implant supported denture.
Much better.
But it is super expensive also.
Yes.
So this one, I guess, is like only a couple implants or 4, couple down, couple up, whatever it may be.
Yes.
And as more as you put in, 3 or 4 up or down would of course always make it better, right? I assume.
Yes.
As more
Correct.
legs you have to hold it, right?
Correct.
But it is one way or the other way a way to bring down the cost drastically and still get life. You still can chew on an apple, can you?
Absolutely.
Beautiful.
You absolutely can.
You know, which with a normal denture,
it's much
I don't
more
think so, all right?
Yes, it's much more economical than going with full implant case. At the same time, it gives you a significant part of the benefits of a full implant case.
Now let me ask you, a person comes in and unfortunately he comes in, so to say, too late. He needs denture, that's it, because his
Sure.
mouth is gone. He can't afford a roundhouse of implants. And frankly, he cannot even afford implant-supported denture, those two. Can he go and get a normal denture, however, and says, a half a year later, I'll come in with the money for the implants? Can it be upgraded, is my question.
Absolutely. Absolutely. That happens all the time.
Good.
Yeah, anytime.
So it is something, it's not like, okay, you do this or that or nothing,
Yes.
you're stuck. No, you can upgrade.
Especially for people who've had dentures for like 5 years. And you know, once you have your teeth removed, you're continuously losing bone.
Yes,
So-
I've heard that.
So, especially on the lower jaw, patients will have a denture for 5 years and find that the dentures now are really fitting poorly. And even they'll go and have it relined, but even then, they don't have the same retention they had 5 years ago. Excuse me. At that point, it would be a good time to maybe consider going with 2 implants. Yes.
And did I understand that right or imagine right? You could use an old denture as long as it overall else still fits you. You like the form because you know you can make a denture a little bit like a cosmetic roundhouse of veneers or crowns or implants. You can make it any size, shape, form, color you want.
Correct,
right?
correct.
So that's one of the advantages of a denture, right? You can just make it look the way you want.
Absolutely.
Right? Now let's just say the guy has a denture which fits his current design. You know what I'm saying? Could he then use that denture and put implant in it even? So that he
Absolutely.
doesn't even need a new denture anymore?
Absolutely. Oh, wow. Absolutely.
So one can upgrade even that way. As long as, you know, one wouldn't put a new engine in a car which otherwise is falling apart, kind of. That wouldn't be yeah.
Yeah. Listen, if the denture is working,
Yeah.
and
suitable fits in terms of looks and all that.
absolutely, all you need to do is just place the implants and you adapt the denture to the
Right.
implants.
And even there, put 2 in it now. If you think you need 3, put another 1 in later. Do only the bottom, do only the top, and then do the, you know, kind of work a year or 2 to upgrade yourself. Beautiful.
Correct.
Wonderful. Thank you very much, Dr. Charles.
My pleasure.